Good evening and welcome to our Healthcare Leaders Needed information session. At a time when the world needs health leaders, I'm delighted to have so many of you join us today to learn how you can be one of those leaders. I'm Dr. Tanya Packer, Director of the School of Health Administration, and very excited to see all of you today. The Indigenous peoples of Canada have been the owners of our land for many years, so today I would like to start by acknowledging that Dalhousie University sits on the ancestral and unceded territory of the Mi'kmaq. This means that we are all treaty people. Before we launch into our formal program, I have a few housekeeping items that I hope will help our time together today go smoothly. I'm going to ask all of you to mute your microphones throughout the presentation and when not speaking, to avoid any background noises that can be distracting for everyone. You can leave your camera on or off, whichever you prefer. If you're new to the Teams platform, you can mute your mic by clicking on the microphone icon. This will put a line through the icon, and to turn it back on, you just click on it again and the line disappears so that you know whether it's on or off. The same applies to your camera. You click it to turn it on. You will find these icons in a menu bar that might be at the top or at the bottom of your screen. If you don't see it, hover your mouse over your screen and it should appear. And just in case you're worried, we have Kathy behind the scenes who will be helping to mute and unmute people as needed. There's two other icons I'd like you to try to locate. One icon is to raise your hand and the other is to open the chat box. The chat box icon is a speaker, Dr. Brenda Merritt, the Dean of the Faculty of Health. Dr. Merritt, thank you for taking time from your busy schedule to share a few words of welcome with us today.
Thanks, Dr. Packer. I'm just so pleased to be here. Every year I always prioritize coming to the School of Health Administration events. I absolutely love hearing what our students are doing, what our alumni are doing, and our faculty and staff. When I hear what is happening in the school, I'm filled with such pride at the leadership and innovation of what our students, faculty, and staff are doing. And as Tanya said, what a time for health administrators and to get the rich education that you can get here at Dal. In the midst of this pandemic, we have graduates of this program working, tirelessly to ensure that the operations of our health system and health organizations are running smoothly. And what a career it can take you in so many different places. But I really look forward to hearing from our students and engaging with our community tonight. And I'll turn it back over to Tanya. Thanks for inviting me too.
Thank you for being here. We really appreciate it. Thanks, Dr. Brenda Merritt. So now you've met our dean, I'd like to meet you. So in the chat box, please type your city or the country where you're connecting from today. This is why I wanted you to find those icons. I'm curious to see where people are joining us from. So if you can type that in the chat box. We have some Halifax, Toronto, beautiful Halifax. Toronto, we must have people from further away. Nanaimo, definitely further away. Waterloo. Nigeria, that's far away. India, how exciting. Ooh, Slave Lake, I bet it's cold in Slave Lake these days. Nepal, it'll be warm there. So this is absolutely the value of a virtual event. So we're delighted that you're all here, but seeing all these countries does remind me to tell you a little bit about how COVID is affecting the school right now, because our MHA right now is completely online. All our students are studying from home, from coffee shops, and from many places. We are hoping to return the school to face-to-face classes by September, but like most things today, that decision will not be made until closer to the time. I do want to give a special welcome to those of you from outside Canada. I'm pleased to let you know that Dalhousie is a designated learning institute. That means we're able to accept and have international students come to Canada. And although visas and travel are a bit more difficult right now because of the pandemic, Dalhousie is accepting international students, and we do have lots of supports in place to help folks get visas and study permits. So I know you're here to learn about the program, and over the next 45 minutes or so, I'll tell you a bit about the program. You'll hear from some of our students and one of our recent graduates, and at the end there will be time for us to try to answer your questions. So let me get started. Let me tell you a little bit about the Master of Health Administration program. That's what you're here to learn about. So next September, we will welcome students into a brand new intensive 16-month master's program. The curriculum is based on the National Center for Healthcare Leadership Competency Model. And that model is composed of 28 core competencies that represent the knowledge and skills that health leaders need in today's health environments. And as the COVID pandemic has taught us, health leadership is never more important than in a complex, fast-paced, unpredictable situation. The 16-month program is composed of 3 academic terms and a 4-month full-time residency period. During the residency period, students are paired with a healthcare agency and a very senior health leader as a mentor. They often work on a project designated by that agency that gives them the chance to practice all their skills and further develop their competencies. The residency is sandwiched in between 2 academic terms, the residency, and then a final academic term. So if students are finished by December of their 2nd year. During the residency, selecting residency sites are also dependent on students' interests and career goals, and we try very hard to personalize that and connect students with the best residency for their goals. And in most cases, students receive a significant financial stipend during their residency period. That always helps pay with tuition and the cost of your education. There's 3 other unique aspects of our program that I'd like to share with you. 3 things that make our program different from others. First, our program is designed to ensure that no matter what your first degree is, you will graduate with the needed competencies to enter the field of health administration. If you have a healthcare background or experience, that's certainly an asset and will aid your learning, but it's not a requirement to enter our program. This makes our program a little different from many programs that require 5 years of healthcare experience before you enter. Second, we're very proud that our program is one of only 3 similar programs in Canada to achieve accreditation by the Commission on Accreditation of Healthcare Management Education. And this is a designation that is recognized throughout the US and Canada as a measure of the quality of the education program. The final difference I want to bring to your attention is our combined degrees and thesis stream. And this sets our program and our student body apart from others. Our JD MHA program has been in place for a number of years. It allows students to graduate with both a law degree and an MHA.
I come from a background in kinesiology, but after I finished my degree, I then moved to Portugal and opened a clinic there where I was performing movement rehab along with a few chiropractors. And I decided that I would come back and continue my education in health administration and law. I'm going to speak to you first a little bit about the Elements program, which is a mentorship initiative the School of Health Administration provides for its students. In the program, students are matched up with leaders in the field of health administration, and this is based on their interests and career goals. And this is all done for the purpose of building key competencies in the field, as well as to start building connections and to really help assist you in recognizing your strengths and to overcome challenges you might be experiencing. For myself, coming into the program, I had only ever really had more informal mentorship relationships. So Elements kind of provided me with a unique opportunity to speak regularly with a mentor who had a wealth of knowledge in so many different areas that I'm interested in. And it also gave me a direct line of accountability to think about and reflect about issues affecting the healthcare sector in Canada, and of course beyond that. And aside from this, the program creates great dynamics between mentors and mentees through the matching process. And this is where personality, interests, and learning objectives of the student are taken into close consideration. I know that going through educational programs can definitely bring with it an air of competition and feelings of uncertainty towards your own abilities. So this is just an incredible opportunity to get some continuing support in these areas while really pushing you to develop yourself as a professional and, more importantly, as a person. Moving to a related area, regarding the school's alumni network, the network of MHA alumni is really one that spans far and wide. I personally have had the opportunity to connect with people from so many different backgrounds and life experiences who have passed through the MHA program at Dalhousie. And this includes CEOs of healthcare organizations, physicians, lawyers and legal scholars, consultants, entrepreneurs of all sorts, and so many more. And not only does this provide an amazing opportunity to grow your own network by reaching out to others who have gone through the program, but it also creates an incredible pool of options from which to dip your toes in to gain insights and build your competencies and also your career through the summer residency that students complete after their first year of study. I know for myself, I've had some really life-changing encounters with alumni and other people connected with the program that have provided me with opportunities for growth and development that I likely would never have encountered had I not been associated with the school. So it really is an incredibly wonderful community to be a part of. I'll stop there, but if anyone has any questions regarding the Elements program and mentorship, or would just like to speak further about growing your network and connecting with alumni and other professionals, please don't hesitate to reach out, and I'm always happy to provide any insights I can. Thank you, and I'll pass it over to Emma.
Hi, everyone. I'm one of the Emmas who will be speaking to you tonight. I'm also in the joint JD MHA program with Miguel. I did my program a little differently. I took my year of law first before entering the MHA this year. So Miguel and I won't be taking any courses together until next fall when we enter the final 2 years of our degree. And at that point in time, we'll be taking both health courses and law courses at the same time. So I'm originally from BC, but did my undergrad here in Nova Scotia at St. FX University. And I first became interested in health law there when I was in my 4th year completing my thesis. I had the opportunity to work with St. Martha's Hospital in Antigonish and was examining their holistic care practices with their patient family members. And I was very interested in both palliative care and medical malpractice law in these areas. And so this program has been incredibly helpful in providing me with a more complete picture of the healthcare environment within which the law operates. I'll also briefly touch on the PharmD and combined MHA program that Tanya mentioned earlier. This is a new program that's building upon the success of the combined JD MHA program. One of its advantages is also the shorter time length. So as opposed to completing the 2 degrees separately in 5.5 years, you can shorten them to 5. And similarly, you can take either the first year of either program first, followed by the first year of the other program. There's also a residency component to this combined program, and there's more complete information about the outline and scheduling processes on the Health Admin website. And before I turn you over to the other Emma, I'll just also touch on the Interprofessional Health Education Program, which is a part of our MHA, also very unique to DAL. We had our first session in October, the DAL Amazing event, and it was a collaborative environment in which you get to work with students from the Faculty of Nursing, Medicine, all different health fields at DAL. And it was a great opportunity to learn how problem solving within an interprofessional team might look like in the workforce. So highly recommend the program. And with that, I'll turn you over to Emma A.
Thanks, Emma. Hi, everyone. Emma Archibald. I'm a first-year student in the new MHA program with plans to pursue a thesis. I have a BSc in Biology and Economics from the University of St. Andrews, Scotland, and for the last 4 years, I was working for Deloitte in London, England, in program management. However, my ambition has long been to work in healthcare, and this program really appealed to me as a way to blend my past corporate life with my future healthcare dreams. I'm also the first year rep in AHAS, which you've heard from a few of us already tonight, but AHAS is the student association within the School of Admin, or the School of Health Admin. The aim of AHAS is to promote the professional and academic interests of all members, to act as a liaison between faculty, students, alumni, and the healthcare community, and finally to promote fellowship and community among the students. Within AHAS, we have a president, vice president, treasurer, communications officer, alumni and stakeholder reps, as well as representatives for the first year, second year, and part-time students. I really have enjoyed being a part of AHAS because the size of the school is such that we really have an opportunity to make an impact, and our voices are really valued by our faculty. We host a variety of events throughout the year, supported by subcommittees including professional development committees and social committees. For example, in non-pandemic times, there would be an in-person end-of-year banquet organized by AHAS, where a series of awards are given out based on their respective criteria, from essays to academic achievement and participation in the courses. We're still defining what the banquet will look like this year. However, the hard work of our students will not go unnoticed. So with that said, I'll hand back to Tanya.
Great. Thank you all. You guys just always make me so proud when you speak. You're so articulate and well-spoken. Thank you. I know we also have some other faculty, some alumni, and some students joining us on the call tonight. I don't have time to introduce all of you individually. So here's what we're going to try to do. I'm going to ask everyone who is not a student, a current student, a faculty member, or an alumni to turn your cameras off. And I'm going to ask everyone who is a student, faculty member, or alumni to keep yours on and give a big wave, and maybe even say hello, because that will make sure that your face pops up in the camera.
Hello.
This way you get to see who our school community is. So thank you, everyone. And now I'll ask everyone, please, put your cameras where we're on or off as you like. And thank you to everyone for being here. We just love to see the support that we have. We do have another wonderful speaker, an alumni from our program, and I'm going to ask him to speak in just a few minutes. But before that, I want to just quickly review what it takes to be an MHA student and to enter our program. So of course, there's an academic requirement. Any 4-year degree, an honors or equivalent degree with a minimum B+ average. And this GPA is usually based on the last 20 credits of your undergraduate degree. If you have any questions about your degree or its equivalency to the DAL B+ average, don't hesitate to contact us. You can send us an unofficial transcript, and we can help you work through how your degree will be seen at DAL. You also need to write the GMAT test and have a score of 550 on the GMAT. So because of COVID, the GMAT test is now online. You don't have to go into a testing center to do the GMAT anymore. And we are accepting the results of the online GMAT test this fall. If you are applying to the law school, you will have to write the LSAT test for the law school. So we're happy to accept the results of the LSAT instead of the GMAT test. Now, I know that in some cases, international students cannot get access to the GMAT test. So if you're in that situation, please contact us. We may be able to accept the graduate, the GRE test instead of the GMAT. So if you're running into problems, don't hesitate to call out, contact us, and we'll help you figure out your best way forward. Another requirement is proof of English language. This proficiency is for international students. And there are a number of different ways you can prove your English proficiency. The TOEFL test, the IELTS, the CELS, or the Pearson are all accepted measures. And if you go on the site, or if you want to talk about it later, there are scores that you need to achieve for your language proficiency. You need 2 academic references. And here I give you a little bit of advice. Please ask someone who has been your teacher from an academic institution to be your reference. If you ask someone from a workplace, they will have difficulty filling in the actual form, so it's much better to have an academic reference complete your references for you. We need a resume, CV, and we want you to tell us a little bit about why you want to obtain your MHA in a statement of career interest. So a critical piece of information is your complete package must be received by April 1st to be considered for any of the scholarships. So the complete package is more than just the application form. It's your transcripts, previous academic work, at least 2 academic letters of reference, your resume or CV, your statement of career interest, proof of your GMAT scores, and your English proficiency, and a completed application form. All of those documents get sent to healthadmin@dal, so HEALTHADMIN, healthadmin@dal.ca. You don't have to send them all together. Shelley does an amazing job of tracking and monitoring your applications, and she'll be in touch with you and let you know what's still outstanding and watch until it's complete. You can also address any questions to Shelley Weir at the healthadmin@dal.ca email, because she's there behind that email, and she has almost all the answers. She's where I go for answers. You can also type any questions you have in the chat box now, and after our next speaker, we'll have time to answer them. So it is now my pleasure to introduce Dr. Alejandro Ocampo, who completed his MHA in 2018. Alejandro completed his medical training in Mexico before he joined us as an international student, and we're really happy that Halifax has now become his home. He's currently the general manager of Maplestone Extended Care. Maplestone is home to 87 clients requiring nursing home care. He's also involved as a mentor in the Elements program that you've heard about. So we're pleased he found time to join us tonight to share a few thoughts. And Alejandro, I'm going to turn it over to you. And I really hope I got your position right, because I know you get promoted about every 2 months.
Thank you very much, Tanya, and thank you very much for having me. I'm hoping everyone's keeping safe at home with everything going on with the pandemic. But just going back into what Vishal was saying, as an international student, I'm also an international student, and I came originally from Mexico. So just give you a little bit of my background. Like Tanya said, I went through my medical degree back home, and I practiced as a physician for around 5 years. I had the pleasure to work in Spain, in the United States, in Mexico. I opened my own private practice. And then one day I had that itch that I wanted to travel, so I decided to work on a cruise ship. So I worked on a cruise ship as a medical doctor for 8 months. I would never do that again, but it was a great experience. And working in the cruise ship, part of the ports where we stopped, one of them was in Halifax. So I pretty much got off the ship and I found my way to Dalhousie. I heard about the program and I thought that's what I want to do. So I went back home, and like Tanya said, it was a fairly easy process. I went through the application, I wrote my GMAT, got my English test, I applied and luckily got accepted into the School of Health Admin. And part of the reason that I made the decision to join the School of Health Administration of Dalhousie is seconding what Claudia and Mary were mentioning, is that the school is CAMI accredited. The school has a residency component, so you can get to practice and go hands-on with your training, and the opportunity to just be part of Dalhousie and the reputation with the school and all the faculty, and also the strong partnership that the school has with the Canadian College of Health Leaders. So I underwent the 2-year program at Dalhousie, and as an international student, it was very beneficial. Particularly with courses like healthcare law, where I got to learn about the Canadian healthcare, and I got to familiarize myself with their legislations and regulations, which is invaluable now. I also really appreciated to get finance and get statistics classes, strategic directions, organizational designs. It was a great experience. I had the opportunity to do my residency at the Nova Scotia Health Authority. And the other thing is, I mean, Dalhousie has so many opportunities to volunteer. I was lucky enough to be able to volunteer not only at the Hope's Health Student-Led Clinic, but also at the AHAS. And I was also part of the Dalhousie Medical Campus Response Team. I mean, if you manage your time, your opportunities to volunteer are great, and to network and meet a lot of people. Faculty were great, so nothing but positive to speak about the school. And I was lucky enough to land the job right after I completed my program with Shanix. And like Tanya said, since then I've been able to grow through different positions, and I went from managing 3 people at the beginning, and now I'm managing a little bit less than 200 people and overseeing 87 residents in a nursing home. And I just can't tell you how valuable it is to have gone through classes where you get to deal with unions and you get to understand how to set your strategic direction, how to engage your staff members, how to create ownership, and how to create sustainable programs. So I really think that if you're like me and you're thinking that you want to be a healthcare leader and you see yourself in a position where you're going to be managing teams and overseeing large projects or large numbers of people, the program is great and it will be invaluable. So I would greatly encourage you to join the School of Health Admin.
Thank you, Alejandro. Do you have 1 minute to tell us how you've managed COVID during this time? What's it like to be in a healthcare institution as a leader during COVID?
It's changing all the time. It is very hectic. Unfortunately, being in long-term care, where our staffing levels can be affected from one day to the next. If someone is getting tested, for example, they can't come to work until they get their results back. We have a lot of employees that are families, so if one of them is getting tested, the whole family needs to stay at home. Same thing since we're in long-term care, managing families and their expectations and their visitation rights. We also have to deal with residents in palliative care and end of life. So we need to accommodate for families to be able to be together at that time. So it's been very hectic and very challenging. I also jumped into this new position right when COVID started. So I haven't had the experience to deal with normal long-term care apart from COVID, but everyone keeps telling me that if I survive this, I'll survive anything. So I'm just keeping my fingers crossed and just pushing through it.
Wonderful, thank you. And a number of people have touched on the Element program. And I know that we have Robert Zed here tonight. He is our executive in residence, and he is one of those people who is behind students every step of the way. He's there as a resource for you, and he manages the Element program, and we just are so much a richer school for him. So thanks, Robert. So now it is time for questions, and I can see there's a very active chat going on in the chat box, and we're going to now open the floor so that we can answer your questions. There we have Robert in Full Life. Hi, Robert. We're going to type, if you want to raise your hand and turn your mic on and ask a question, put it in the chat box, either one. Karuna, who is another one of our MHA students, is here to help. She's going to be helping me with the chat box, and Jackie is going to be helping me with people who have their hand up. So let's start with a question. Jackie, who has their hand up? Who is first in the list?
So Dr. Ahai, Ghosh, Gosh, he's the first question.
Great.
Go ahead, Doctor.
Good afternoon, everyone. Thank you so much for such a lovely informative session. I had one question for everyone, or the students and also the faculty and the alumni members. Is the JDMHA a continuous program, or can we take a gap in between, like for further financing, or maybe take a break for a job, for further educational loan purposes? So is that available, or is it a continuous program?
What a great question. It is a continuous program, 4-year program, continuous. The residency summer, typically students are paid during their summer residency, so that helps 1 year anyway. And I believe many students do work in the summer between the other years of their program. One of the JD students might be able to, JD MHA students can pipe up and help me with that. But taking like a whole year out, of course, in a crisis that can be done, but it may actually mean that you have a continuing fee that you have to pay sometime later. So I'm not saying it's not possible. I'm saying if you wanted to plan your life that way, it would probably be a really good idea to have that conversation early and see whether it is possible. And just to reiterate, you have to apply to each of the programs independently and be accepted independently in both the law program and the MHA. Emma, is it true that students work during the summer?
Yes, you can. So depending on whether you do, so say you did your year of your MHA first, and then you had your residency after that. So you would, as Tanya said, get a stipend for that. Then if I did my year of law the next year, so that would mean, so I would have 3 years of law after that. The first year of your law degree, you don't actually have to do a job per se. So you could do a job that was perhaps would give you a bit more pay during the summer. I worked after my first year as a project manager at a all boys Catholic school in BC. And so that was a little higher paying. So that's how I supplemented my income for the next 2 years. Your last 2 years of your law degree and the joint program, you will have to get an articling position. So usually I will say that I have heard that they do pay fairly well. So you are able to get through the next couple of years there. But the student loan program is also a big part of DAL, as and I think there are a number of bursaries available through the law school in particular. I don't know if Miguel has more information on that, but if you were interested, I would highly recommend reaching out to the scholarship and bursary committee through the law school. I don't know, Tanya, if there's also one through the MHA, but they are very well set up, so they'll answer your questions.
And one more thing, is the LSAT required for the JD, like the JD program? Is the LSAT mandatory? Because I have given my GMAT, my exam. I'm a dentist by profession. I've completed my Bachelor of Dental Surgery from India. So I'm a practicing professional. So I have given my GMAT. So will I have to appear for the LSAT also? Because I have no idea about the LSAT. So if I'm like, I'm not the profession of the law thing.
Yes.
So what should I go about?
So to really understand the application process for the law school, it's best to go to the law school at DAL and look at their application information. But I know that you do have to write the LSAT for to enter the law school.
Okay.
So
thank you so much.
Karuna, great questions. Thank you. Karuna, I know you're monitoring the chat box. Do you want to offer us a question from the chat box?
Yes, Tanya, I actually have a few questions there. The first one asked by Kanchi is about scholarship opportunities and loans for international students. She wants to know if there are any.
That's a difficult question to answer. There are not as many scholarships at the master's level as there are at the PhD level, for example. The school does have and offers some scholarships, but these are not scholarships that are sufficient to pay all of your tuition and have a living allowance. So there are some scholarships, and you don't actually have to apply for the school scholarships. As long as you have your full application in by the 1st of April, the students, all students who have full applications and been accepted are considered for the scholarships. Now, in terms of other scholarships, there are many different scholarships that students can apply for that are at the Dalhousie level or with different organizations. So there's some small ones that come from the school, and then there are others from Dalhousie. So we can, the best thing will be to get you, send you information and the links to where to look up those scholarships, because depending on your background, where you're from, what you've studied, what your background is, you may be eligible for one scholarship and not another. So some of them are very specific to some individuals. So I know that Shelley will be sending out an email to everyone tomorrow. Shelley, would you be able in that email to add the link to the scholarship page for Dalhousie? I'm sure she will be able to.
Yeah, I can add it, Tanya.
That would be great. Thanks.
To add to that, there are also provincial level scholarships available for international students and international students applying to graduate programs. So I'll try to look those up and just maybe add them to the links and maybe send them to Shelley, and she could add those in.
Vishal, that would be really appreciated. Thank you. Jackie,
I've got another question for you, Tanya.
Okay.
Barbara is asking if someone's got a degree that was obtained 20 years ago, would it still require academic references? Because I think it'll be difficult for them to reach out there.
Yeah, that's a really good question, and one we face regularly with mature students.
Tanya, I actually put a response to that on there. If they just want to email health admin, I can get back to them.
Okay.
I think I put a response to Barbara on the chat.
Okay, great. So Barbara, yours is a unique situation, and it is one that we can give you some advice on. So if you email, she will be able, the health admin email, she'll be able to guide you through some of that. And anyone else in that situation, please reach out to Shelley.
Sorry, I'm just going to jump in. I think there's a number of questions about career opportunities and where people kind of end up after the MH. There's a few questions on that. And I don't know if somebody like maybe even Alejandro wanted to speak to that a bit more because that seems to be of interest.
Thanks, Mary. And that's a great question. We do actually track employment rates of the students, and within 3 months of graduation, on average, at least 80% of our students, sometimes higher than that, have employment in their field within 3 months of graduating. So that's kind of the statistics of employment. Depending on whether you've done the JD-MHA or the MHA, we have people who are working as healthcare leaders everywhere from one person, one record, so medical records and taking leadership roles there. We have people who are, like Alejandro, managing long-term care facilities. We have people who work for Health Canada. She's just retired, but the CEO of Quality and Safety, Patient Quality and Safety for Canada, was a graduate of ours. So there's quite a wide range of places people end up working, everywhere from, hospitals and institutions to health-related agencies to long-term care. And I would invite anyone else, and maybe Robert might be able to answer that. Robert, Chris, David, anything to add?
Hi, Tanya. It's Robert.
Hi, Robert.
Sorry, the specific question cut out.
What are the job opportunities and where do our graduates end up working?
Oh my heavens. Our graduates end up all around the globe, whether it's in long-term care, in acute care, a government work, association management, private sector consulting. There is a broad range. Some go to law firms, some go into the pharmacy world, some will go into public health. So it really is a very, very broad perspective, and that's why we have so many streams where people will subspecialize or expand into an area of interest.
And the level at which they typically enter is mid-management level.
It depends on the experience base from which our students come to us. So there are two areas where you would enter the system. Depending on if you have not much experience, and you'll start as a project manager very typically, and that would be where a good half of our students end up. And if you come from an experience base, if you're formerly a pharmacist or a dentist, or if you're formerly involved in administration and you're getting more professional certification, you would go into a mid-career opportunity, like a director or even executive director, depending on what your experience base is.
Great, thanks, Robert. Jackie, whose hand is up next in the queue?
So Dr. Ghosh would like to ask another question.
I had a specific question for Vishal. So I'm also from India, like him. So I'm a dentist and he's also a health professional, I guess. So how was his transition? How did he transit? How was his transition from a practicing health professional to an MHA administrator? So how was the journey? Like, what is his difficulties and what his experience is like? I wonder that, if it's not of an issue.
Hi, I am. So to answer that question, so I saw my career goals shifting while I was in med school itself. And during my practice, I actually participated in a lot of administrative roles. So I was working with multi-specialty clinics where I used to practice the first half of the day, and the next half of the day, I was working as a consultant to digitalize their systems. And my career focus then shifted to global healthcare solutions and health system changes. And that's why I looked for a course that would prepare me for that. And the MHA syllabus really aligned with those goals of mine. And that's why I decided to transition here. Obviously, if you haven't studied, say, something like statistics or accounts and haven't conducted a lot of research during your time at med school, there is going to be a learning curve, definitely. But what I can promise you is that the resources provided by the school are more than enough to support that transition. And I have nothing but good things to say. I mean, I was very apprehensive at the beginning, but that has completely changed now. Now I just feel like this was my calling.
Thank you so much. Thank you so much, Vishal.
Not a problem.
Thank you so much.
Jackie, are there any other hands up?
There's one other, her name, it's Pushpa.
Pushpa, what is your question? I think we need to unmute. Pushpa, if you want to unmute your mic.
Hello, ma'am.
Hello, welcome.
Thank you. I want to ask that is experience compulsory required for the admission process, or with the volunteers and internships? Like I have internship done in 3 different hospitals, so we can apply with internships, or compulsorily we need the experience.
So one of the unique features of our program is you don't require
my background is healthcare management itself. So
yes, when you talk about experience and volunteer, for our program, you don't require healthcare experience or an internship or employment specifically in health to enter the program. So as long as you have a 4-year bachelor's degree, then we can welcome you into the program. Your health admin and health management experience will be an asset, and it means that you will gain something extra from the program, but it's not actually required as an admission criteria.
Thank you, ma'am.
Tanya, 5-minute notice.
Thank you. And we have another hand up or another question from the chat.
There's a hand. It just says D though by it. I'm not sure.
So D, who has their hand up.
Hi, my name is Debbie. My name is Debbie Adara, and I live in Halifax. I'm a registered nurse in Nigeria. I recently moved to Canada, and I studied at the School of Nursing in Nigeria. I got a diploma in nursing, and then went to Edinburgh Napier University to get a degree. So the degree at the Edinburgh Napier was for about 16 months. So it's not a 4-year program, because it was a top-up degree from the diploma that I had that I got from the School of Nursing in nursing science. So would that qualify to be able to enter into this program, you know, with the diploma and the top-up degree from Edinburgh Napier in Scotland?
Wow, that's a tricky one to answer without actually seeing your transcripts and your degrees. Shelley, would you suggest that that Debbie, do you have copies of those degrees or transcripts?
Yes, I have a copy of the School of Nursing diploma, and I can get the one for Edinburgh Napier.
Shelley, would you agree that the best option is for her to send those to you so that you can have them evaluated, and we can give Debbie some advice on whether they would meet the Dalhousie admission criteria?
Yep, she can just send them to me, to healthadmin@dal.ca, and we can look at them because we go by the credit hours for the programs as well as the courses that you've taken. So if you want to send them to me, I can have them looked at, and we can determine if you would meet the requirements.
Thank you.
Karuna, anything from the chat box that we haven't answered?
Yes. Hannah wants to know if there are any career opportunities in medical device companies.
In medical device companies? Good question. Don't know if, I know we have students or graduates who have gone into, I think, the pharmaceutical industry. Medical device, I guess it would depend on your interest and your resourcefulness. The health admin, you know, the health admin program, the skills you gain are very much in the project management, human resources management, financial management, all within healthcare. There's a law course, which I think in the device world is probably pretty important. So I don't know that I have any specific examples of looking into the medical device company. Mary, I see you have your hand up. Do you know someone that's moved there?
Sorry.
Yeah, go ahead.
I know that other students have been connected to consulting companies for medical technology and different tech companies in that regard. So I don't know if that's similar to what you're referring to, but I do know students have gone into those kind of, maybe not developing the exact devices, but that kind of consulting and management of those different technologies.
Can I also jump and say that we've had students go into Medtronic. So Medtronic is the one who develops pacemakers and the diabetes pumps. So we've had students do the residency there, and it's, I think, a good opportunity for anyone looking into medical devices.
Great, thank you. Good. I'd forgotten about that, Alejandro. Thank you.
Shelley has her hand up.
I just want to follow up on Alejandro's comment. We actually have an alumni working at Medtronic. One of our alumni worked at Medtronic. They got a job.
Hi.
there.
Sorry to interrupt. This is Hannah who asked the question. So I actually work at Medtronic, so I was interested to see kind of where, others who go through this program end up. But thank you. I think I might know who you're talking about. Small world, but thank you so much.
So you have an inside
scoop.
source. You've got an inside source.
Actually, two people at Medtronic that I know of who did this program, and I was out for dinner and they were ranting and raving about it. So that kind of piqued my interest. Thank you.
Tanya, there's another question. Is there a possibility to apply for the JD MHA after the first year of MHA?
Yes, there is. That's certainly an option, and it's not unusual for our students after the first year of their MHA to apply for and enter the law program. So I do notice that it's now 6:30, and I really want to respect all of your time because we said this would be 1 hour. So I'd like to end the formal session now. However, if any of you wish to stay on a bit longer, we're happy to remain online. There are a few of us who will remain online to answer your questions. But I don't want to extend for those people who I know have other parts of their lives to look after. So before I just end the formal session, I want to thank especially all our speakers for sharing their experiences tonight. I want to thank all our faculty, students, and staff for being here, and our community, our SHA community for being here. I want to thank all our potential new students for joining us. Tomorrow, we will send you an email with our contact information, so if any questions come up, you'll be able to get in touch with us. And we do hope this has piqued your interest and that we'll have the opportunity to welcome you to our school and our program soon. So good night to those of you who have other commitments, and anyone who wishes to stay on the line, please feel free, and we'll see what we can do to answer your questions.
Thank you, Tanya.
Good night, everyone.
Tanya, there was one more person who has their hand up, and it's Ellie.
Okay, Ellie, go ahead.
Hi, I have a question regarding GMAT for admission requirement. I had a DAT exam. Just wondering if you accept that one instead of GMAT or not.
I'm sorry, which one?
DAT, DAT, dental admission exam.
Shelley, can you help me there? Have we accepted that in the past?
No, the scores that we accept are the GMAT and the GRE and the LSAT for the JD, and those are the only 3 scores that we accept. Just because those test different things than.
Right.
Okay, thank you.
I noticed in the chat box there were a number of questions about the PharmD program. Susan Manser, are you still with us?
I am Brenda, or I am Tanya, sorry.
Have you been able to, I know you've been following some of those. Have we answered all the PharmD questions?
I think I have been able to reply to all of them. I just put a little note in the chat a little later on because there were a few questions about applications, and I just had noted that the application processes are separate and the entry requirements, the admission requirements are separate. So I had a little note about that, and certainly for the PharmD admissions requirements, you can check the Dalhousie University College of Pharmacy website. The requirements are listed there. One question I didn't answer fully, I don't think, someone had asked about what if they were accepted into one program and not the other. From my perspective, if you were accepted into the PharmD and had applied to both, we would still take you in the PharmD. It doesn't preclude you from continuing in the PharmD, and I assume that would be the same if you were accepted into MHA, but not the PharmD program. Is that right, Tanya?
Yes, that would be absolutely correct. And as we've said already, we do know that many students start in the MHA program. Maybe they didn't know about the JD program before, or weren't successful in their first application and they apply again during their first year and then subsequently start the JD program. And the PharmD MHA is brand new. So you know, we still have our testing, you know, our training wheels on for that program, but I would expect it would be something similar. There would be no reason that if you applied to the PharmD and got in after your first year, we would welcome you into the joint program. If it was after your second or third year, that probably wouldn't work out so well in combining the 2 degrees, but certainly after the first year, I can see it being a very easy transition and an easy fit.
Yeah, absolutely.
More hands up?
Yes, Mary Lou Leroy is next. Go ahead, Mary Lou.
Hi there. I have a Master of Public Administration from Dalhousie. So what would the entrance requirements be for the MHA program for me?
Wow, what a great question.
I thought so. What would I need to do the GMAT again? I mean, I had to do the GMAT in order to get the MPA. So
I'm going to defer to Shelley, but I do believe if you already have a master's degree, we can waive that requirement. Shelley, is that correct?
Yeah, we would need to look at transcripts and that sort of thing, but you can send your documents in ahead of time. Like if you don't want to apply, if you want to know, you know, what we would require, we can kind of give it a first round and let you know for sure. Because it would depend on transcripts, the credit hours, that sort of thing.
Mm-hmm. Okay. Well, you know, like I say, I have the MPA, so and it's from Dal. So to whom would I send them? Is it something that you could access yourself, or do I have to send them in?
If your transcripts are from Dal, we can access them directly. You would just send me an email to the health admin at dal.ca account and just give me your student ID number.
Okay.
And then look it up. But where you have a master's degree from Dal already, I would suspect that the admissions committee would waive the GMAT requirement.
Okay. And how long would the program be then, since I have the MPA? How long would the MHA be?
It would depend. If you took similar courses to ones that we offer, the instructors would look at your courses that you've taken to see if any would be considered equivalent, and then you could request for an advanced standing or advanced placement. But that's all done once your file is reviewed. It would be determined whether or not you'd have to complete all the classes or you'd get waivers.
Okay. And it's to healthadmin@dal.ca?
Yes.
Okay. And a name? Is there a name I should?
I get them anyway. It's Shelley, so but it doesn't matter. I respond to them.
Whoever gets them, you'll get it eventually.
Yeah.
Okay, great. Thank you very much.
You're welcome.
There's another hand up, Kennedy. Go ahead, Kennedy.
I'll put my camera on here so I can make it a little
thank
personal. Yeah, I just had a question. Mary, I saw that you answered the question in the chat. It's just about the application process and like the career interest aspect to it. Is there like a word count or a page count, or like, I didn't really find anything on it. I've started that part of the application, but I just want to make sure I'm not like overdoing it or underdoing it.
Yeah, I answered in the chat box based off of what I had done for my application process, but I mean, I would refer to Shelley just because that's the official.
Okay.
Sure. And I turned my camera on so you can. We actually don't have a word count per se, as long as you basically, however long it takes you to explain why you would like to be considered for the MHA. You know, some people include what they hope to do after they achieve the MHA degree, just so we know if you're, you know, a fit for the program, if maybe there's a program that may be better for you. Just basically why you're interested, would like to be considered.
Okay, perfect. I saw something that was like they recommend 2 to 3 pages. So
no,
yeah, I would say
long.
yeah, mine was roughly a page and a half.
Okay. All
that
right.
was-
No.
That was mine, Elise.
No, they do average. The majority of them are like a page and
Okay.
a half at the tops.
Okay. Perfect. And then I had one more question as well. So I've looked into like the JD part of adding to the degree. I know nothing about law, like that's not my background. I'm in a math or a public health degree right now. So if I decide to add that in my second year or like in my first year, I can do that. But right now, if I decide I want to do it, I can write the LSAT instead of the GMAT for April 1st.
Yeah, that's
Just
correct.
making sure I got that all right. Okay.
So if you're thinking of the combined program, it would be kind of your advantage to do that when you submit your original application. Otherwise, you're going to have to write 2 test scores because we don't accept you with your LSAT if you're not applying to the law school.
Right.
So
that's what I was getting from that. So that's
we can't obtain scores for LSATs unless we have a connection to the law school because they won't send them directly to us.
Right.
Yeah. So you have to apply for both the law program and the MHA this year in order to use the LSAT.
Okay. Thank you so
Tanya,
much.
if you wouldn't mind me piping in, I'll just say, Kennedy, the way I did it was I wrote my LSAT first, submitted my LSAT to the School of Health Admin, and then you can, depending on which way you want to do it, you can pick which year you do first. So it just gives you a little bit more leniency depending on how you're feeling.
Okay.
Yeah, and also someone is who was in my cohort, she actually wrote her LSAT in January of the first year to start law in the second year. So there is a lot of flexibility in which order you take the tests if you aren't 100% sure, or if you want to just get into the MHA to begin with, or the law degree to begin with.
So I could sorry, I'm asking so many questions. But so let's say I apply to both of them. I'll write my LSATs in January like your friend did. And let's say the score isn't good enough or I don't get into that law aspect. Do I then need to figure out how to write my GMAT, or am I clear?
No, if you are applying to the combined program and the law school says, no, we want you to have a higher score or whatever, you can still start with the MHA and then reapply to JD within your first year.
Perfect.
Yeah, sorry, that's what I mean. We were in our first year of the MHA, and she was still writing her her LSAT in January of her first year of the MHA.
Okay.
So you can continue because she was just trying to increase her score.
Right. Okay. Perfect. Thank you so much. This is so helpful.
And there's a follow-up question I see in the chat about that. Shifting from the MHA to the JD MHA, what is the likely fee difference? Well, there is a large fee difference because if you are only in the MHA, you're only paying for the MHA. If you're in the combined program, you have to pay for both programs. And so it's the difference between 16 months of education and 4 years of education. So there is quite a large, there's a large fee, and the law school is probably, I think it's a bit more expensive than our program as well. So there is, the difference is though that it's 2 degrees and 4 years instead of 16 months.
There is, on the registrar's office website, there is a link that will show you what the program fees are for the combined MHA JD program. So it'll give you an idea of what the cost would be.
Yeah.
Tanya, there's another question which asks, when do they hear about the admissions decision?
We try to get our decisions out as early as we possibly can, particularly for international students, because they need more time for work permits, study permits, all those sorts of things. We don't have a specific, I can't say it's on this exact date. I would say early in the new year, Shelley, would be a fair answer.
Yeah, If we have a complete application, because sometimes what happens is we're missing a piece, like we could have everything but a GMAT score. So we can't make the final admission decision until we get that actual score. So if it's a complete application, we don't have to like email saying, where's this, where's that. Usually once the committee looks at it, students usually, the form is sent to Graduate Studies with the recommendation, and they'll post it online usually within 2 to 3 weeks. So once our committee looks at it, you would know within like 3 to 4 weeks at the most.
Yeah, so I would, you know, depending on when your application is complete, it could be as early as the new year that you would hear the outcome.
Right. Now, if everybody's applying for the April 1st deadline and they have, you know, 40 files to look through at once, obviously the turnaround time is going to be a little bit slower.
There's another question about the GMAT. They want to know, is there a deadline for taking the GMAT test?
The GMAT's a requirement for admission, so we wouldn't be able to make a recommendation to Graduate Studies because your file would be incomplete without the score. So if you're an international student, hopefully we could have your score by the April 1st deadline. If not, we would just keep your file on hold until it's available.
There was one more question about the format for part-time students. Like, are all the classes going to be in the evening and weekends to accommodate a working schedule for them?
No, right now the part-time option, the program is really best done full-time. The part-time option, you've articulated exactly the reason why. The classes are during the day. Well, if you're in the Halifax time zone, they're in the daytime. There's no evening or weekend classes, so it's not really designed for people who are currently working. We do have a few part-time students, but a part-time student, my strong recommendation is if you're thinking about a part-time program, send us an email at healthadmin@dal.ca, and we could work with you to see whether or not there was a program of study that would meet your needs. But there are no evening and weekend classes offered in the program right now.
Thanks, Tanya. There's another question about if they're approaching the JD MHA, will we be able to gain scholarships or individual fee waiver for the courses separately, or only one funding opportunity is applicable?
Can you ask me that one more time, Karuna? I don't see, I don't have that one on my chat box so I can see it. Could you ask it again, please?
Yeah, it's about the JD MHA. If they can they gain scholarships or individual fee waivers for the courses separately, or only one funding opportunity is applicable for one of the programs?
Okay, so there's a kind of a double answer to that. I think I understand the question. The way the JD MHA program and the MHA program fees work is you don't pay by course. You pay a fixed amount of money. The program is X number of dollars, and that's the price of the program. That is the cost of the program. So it's not by course. So once you have enrolled in the program, that is the course fee that you will pay. And that does not, so that's a separate question to scholarships. So scholarships are something completely different. They would be, you would apply for, depending on the scholarship that you were eligible for, you would apply for scholarships separately from thinking about the number of courses that you're taking. And if I haven't answered the question, please pipe up and ask again so I can understand the question better. And Julia, you in the chat you said, would you say admissions is rolling? Yes, it is a rolling admissions. The typical students are cap is 25 students. Any other questions? Anyone, is there any questions left, Karuna, that we haven't addressed in the chat box or any? I don't think we have any hands up.
Yeah, I'm done with all the questions in the chat.
Okay, wonderful, thank you.
No problem.
So if we've answered everyone's questions, let me wish you a lovely evening, if it's evening where you are. And please stay safe, wash your hands, social distance, abide by the public health guidelines, health leaders, that's what we need to do. And thank you all for being there. And we'll talk to faculty and students soon. Thank you for being there. Bye, everyone.
Bye.
Bye.
Bye.